is a radiologist? What is radiology? We have so many subspeciality and superspeciality in every field. So do you have such fraternity in radiology as well? There is a 3 Tesla MRI, there is a 1.5 Tesla MRI. Throw some light on the entire concept. Is it worth that I ask one of my patients to go to a particular center and get the MRI scan done there? Patient has pain, he has had all the investigations done. Now what the patient should do? Hello, I am Dr. Abhishek Jain from Delhi Foot. Today I invite you on a series of podcasts on healthcare queries. Every week we will be calling in the eminent personalities in healthcare from Delhi, and today we have Dr. Sriram Rajan, Head of Department Radiology at Mahajan Imaging Defence Colony, and he also happens to be the Chief of MRI Division. So today we will be addressing many questions regarding radiology, radiologists, MRI and CT centers, which many of you must be having. So I welcome Dr. Sriram Rajan for coming to our show and giving your time to deliver the answers to many questions which are still unanswered in the field of radiology, which many of our patients and guests must be having. So thank you once again.
Thank you. It's a pleasure to be on this first podcast.
So without wasting any time, I want to ask you first and a very fundamental question. Who is a radiologist? What is radiology? Is it something to do with the transistor radio or something very medical about it? Please tell our guests.
So radiology is basically a branch which has to do with imaging. So it originally started off with X-ray imaging, and a radiologist is basically a person who would read the scans, whether it's a X-ray, whether it's a CT scan, whether it's an ultrasound, whether it's an MRI, and they are specialists who are looking into all branches and basically looking at the imaging. Amongst radiologists also we have subspecialties. So we have musculoskeletal radiologists, people who work only on the brain and spine, people who work only in the chest or in the abdomen.
So you mean to say that you are that person who is required by a neurologist, a cardiologist, orthopedist, a gastroenterologist, because all the ultrasound, X-rays, CTs and MRIs are decoded by you people?
Yes, so we do the scans, and the good thing is that we also interact with each of these specialities and try to answer the questions. So you can think of it as a meeting point of each and every one of these specialities. And patients come to us for scans. A lot of times they look at a radiology lab or a radiology center as similar to a pathology center. They presume that scans are interpreted by machines. As of now, it is still interpreted by humans and with interaction. So we talk to the patients, we talk to the doctors and try to answer the specific question.
So scans are done by machines and read by you people?
Yes, exactly.
Okay, that's wonderful. My next question, Dr. Sriram, is that we have so many subspeciality and superspeciality in every field. Like in surgery, somebody is a urologist, somebody is a neurosurgeon. In orthopedics, somebody is a foot and ankle surgeon, somebody is a knee surgeon, shoulder surgeon. So do you have such fraternity in radiology as well? And is it important to have so?
So we do have subspecialty radiology. There are two types of subspecialty radiologists. One, out of interest. So suppose a person gets more of a certain type of cases, or they have trained themselves more on a certain kind of either musculoskeletal or body or chest imaging. And because the number of referrals that they get, their interactions are more and they learn more. The second form is in which there is a didactic teaching course and they get specialized in that. So for example, in various institutions they have a DM or higher specialization or cardiac imaging or neuroimaging, which cardiac is for the heart and neuroimaging is for the brain and spine.
Okay. Now talking about MRIs. Now we hear that there is a 3 Tesla MRI, there is a 1.5 Tesla MRI, 3 Tesla MRI is better, 1.5 Tesla is obsolete. There are MRIs which cannot be done on somebody who has a pacemaker. There are MRIs which cannot be done who has a metal implant. Please show some light, throw some light on the entire concept.
Okay, so when we're looking at magnetic field strength, we have different field strengths. The lowest field strength is say 0.3 Tesla. Then you have 1.5 Tesla, which is a workhorse, which has been around for a very long time and on which you can do almost every scan. Finally, you have 3 Tesla, and most recently you have the highest, which are 7 Tesla, which are like extremely high field strength.
Okay.
Now, what exactly MRI is and why do we need a higher field strength? Because most people think of magnets as just like fridge magnet or something like that. These magnets are much, much stronger than that. The higher the field strength, the more the amount of signal you get from any tissue. Your body is made up of almost 70% water, and the hydrogen atoms inside them, they get detected on the imaging. Whenever there is any infection, injury or tumor, the water inside that gets picked up on the MRI. Now, when you have a higher field strength MRI, the advantages are that the scan takes lesser time and you get higher resolution images. So it's like in a camera you have higher pixel. So definitely you'll get to see a lot more detail when you zoom in. That's the kind of thing. But like even with cameras, beyond a certain level, sometimes it's not necessary for you to get very, very high resolution. Okay. In our scenario, if there is metal in the field, for example, if the patient has a hip replacement or a knee replacement and we want to scan that hip replacement or knee replacement with the metal in the joint, we can do the scan. There are specialized sequences which are done on 3 Tesla, and on a 1.5 Tesla the amount of artifact or the amount of problems of black and white areas which you get on the scan tends to be lesser, and even lesser on 0.3 Tesla. So suppose there's a patient who walks in and says that he got a bullet in the thigh and they want to get some scan, or they say that common questions people ask is that I've got a stent in my heart, can I get my ankle MR done? So the answer is yes. If they have a recent total knee or total hip replacement, can they get any of the other scans like a brain or a spine or a knee MR? It's safe, they can do it.
Well, if they can do it, then why a form is there which they ask for if there is any metal in the body or not? What is the significance of giving this data?
So if you look at metal in the body, if it has been implanted into the bone, and that is very strongly put into the bone, and the body's pulling of that tissue, of that metal, and gravity is much, much more than that of a magnetic scanner. Which is why if there is an implant, it's not a problem. But suppose there is a free-floating fragment. For example, there is a bullet, and that is very close to a structure like an artery or a nerve. And if there is a small chance that it can move, or if there is any heating chances, then that is actually a risk. So in such cases, we would ask for an alternative imaging, which would be maybe CT scan combined with ultrasound, which will give the answer. You are talking about pacemakers. Now, originally when pacemakers were put in, they are a permanent pacemaker, which means that the person is dependent on the pacemaker for his heart beating. That is a contraindication for MR. You can't do an MR in such a person. Nowadays we have MR compatible pacemakers. In such cases, what happens is that the pacemaker company person has to come along. They reset the pacemaker on an MR mode. We do the scan. After the scan is over, it again gets set back to a normal mode and the patient can go ahead and get back to the normal life.
Oh, wow. And you were talking about risks of a free-floating foreign body in a magnetic field. Can you tell us what risks are involved? What will happen?
So, if there is any metal within the body tissues, if it has recently been come into the body tissues, then the chances of it moving or heating, these are the two main things that we are concerned about. Now, the amount of movement is not going to be so much. Like people think that the metal will come jumping out of the tissue and they'll be bleeding. That's not happening.
Okay.
What can happen is that there can be some amount of movement, and if that movement occurs, it can impinge on something, or it can basically hurt some critical structure. So there are some contraindications which we still use for MR. It means we want to know if there are coils in the brain which are very old. So if it's more than 20 years back, we don't want to do the imaging. If it's within the 20 years, they're usually using platinum coils which are MR compatible. Cochlear implant, which is basically a kind of a electrode which is put inside the hearing organ. The reason why cochlear implant is a contraindication is because the patient would be subject to very loud sounds when they're inside, and it might malfunction. Because it's a very strong magnetic field, any magnetic structure or any electronic structure can malfunction. So if you go in with a watch, and that's an electronic, digital watch, that's fine. But if it's an analog watch, the entire thing will freeze up.
So when you say contraindication, it's an absolute contraindication.
Yes. So intraocular foreign body, which means that if there is a small metal piece within the eye, because the eye is a very precious structure, we don't want to take the risk, even a small theoretical risk, that it can move and lead to loss of vision. So that's the reason why we ask if there's any metal in the body, if there's any surgery done. And we want to know, if we know that, for example, the patient says, I have a total hip replacement, total knee replacement, I have stents in my heart, and I also have a plate in my skull. All of them are safe, but we should know about it so that, that from the history taking point of view, if we don't ask this question, sometimes patients do not expect that they need to know, that we need to know about this. So we want to check out whether whatever that thing is MR compatible, and whether there is any risk to the patient. We are most concerned about that.
Great. That was very helpful, Dr. Sriram. Well, again, coming to the subspecialization or super specialization part, is it worth that I ask one of my patient or any of my patient to go to a particular center and get the MRI scan done there, so that you are reported by a person who is specialized in that department, and that could be 10 kilometers, 15 kilometers away from where I am seeing the patient, or that could be twice as expensive as the MRI which is just near patient's house. I mean, is it worth to send the patient and cause so much of inconvenience to the patient to seek a specialist support for MRI reading?
Yeah, so this is a very interesting question, and I have two anecdotes to answer this. So one of them is, there's a family member who wanted to get an MRI of the ankle done. And they presume that an MRI of the brain is very specialized, and MRI of the ankle is something which anybody can read. And they got the scan done at some center close to their home. They showed the films to me. The problem is that depending on how the scan is obtained, you can make images which are specialized only to look at bone and joints, or which look at tendons, ligaments, cartilage, all of the things which can be causative of pain. So if the scan has been done at a center which is specialized for musculoskeletal imaging, they are sure to pick up the abnormality. If you go in for any diagnostic test, if you go in for a test and at the end of the test you're told you're normal but you still have pain, are you going to be satisfied? So the answer is obviously no.
No. Yes.
Now, if you get a very beautiful scan done, okay, it's a very good center, they got a scan done, but the person who's reading it does not pick up the abnormality or does not answer the question. So your doctor and you are asking, why is there pain on the inner side of my ankle? And if the report mentions something else. So if the question doesn't get answered, that also is not fair. So in such situations, we would always request that you go to a center which is specialized and which tends to answer the questions. So there are a few centers which would look at the musculoskeletal system in detail. The radiologists also are musculoskeletal trained, and they are more likely to pick up all the abnormalities. Foot and ankle is a specialized part of the bones and joints. Very commonly people can report spine and brain and knee joints or hip joints, but to report foot and ankle, they have to know the biomechanics, they have to know what are the most common findings, and they have to also know what is the possible cause of the patient's symptoms. The second anecdote that I want to tell you about is I had a patient who had been scanned at least 6 times over 3 years. And every time the patient would present with foot pain, they would get an MRI done, they would say there's infection, and the patient was put on anti-tubercular medicines. and in a little while you feel better. Scan would say things are fine. Then again they would get a scan done for pain, and again they would say. So for 3 years that poor patient was getting medicines for anti-tubercular therapy. Eventually when the patient landed up at our center, we looked at it and we found that it was a problem by birth in which bones, two set of bones were fused. Biomechanically, what was happening was that because the foot and ankle is a complex joint, if you fuse any one part, the rest of the parts move a lot more, and that leads to inflammation, and that was what was happening to her. A simpler surgery in which they removed that piece of bone and she was asymptomatic. So this emphasizes that you need to have a specialist, a person who's reading the scan, and a specialist who's also treating the patient.
Oh wow, that was a very great example. My next question is, why are some radiology centers, the CT MRI centers, are expensive and some are less expensive? Both claiming to have, say, 3 Tesla MRI, both claiming to have good radiologists. So why is there a discrepancy? What is it that we should look for? Nobody would want to pay more for the same thing at a center.
So when you look at 3 Tesla, I will explain it in a very simpler form. When you're looking at phones, now if you want to buy an Apple iPhone,
Yeah.
you get a brand new phone and you get a refurbished phone or something which has been sold and you get it back. So the one which is refurbished tends to have a chance of some problems inside it, whereas the one which is brand new tends to be better. Similarly, if you have a 3 Tesla, which is a brand new machine with all the features, it tends to have a lot more of good resolution. It has the entire set of coils. So very briefly in MRI, when you're getting a scan done for the foot and ankle, you need a dedicated coil for the foot and ankle. You can't just take a head coil and put it over there. So you won't get a higher resolution image. Now, if there's a center who gets a refurbished MR, they might cut the price to try to, attract more patients. But a lot of times what will happen is that they will not be able to give the same level of quality. It's a center which goes in for the full-fledged MR with a dedicated radiologist and who's also giving films. Like one of the common complaints that orthopedicians say is that the films which they get, if everything is very small, it's very difficult for them to see small structures.
Yes.
So this is why things get cheap. So if you get a refurbished scanner, you get lesser number of films, or you get small images in all of these situations, and also they would not provide you with a CD. You would not be able to look at those images at your home, or your doctor would not be able to examine it. All of those things will be able to cut the costs. So one of the most important things in a marketplace is that you get what you pay for.
Yes.
Right? So if you pay for something more better, you're more likely to get a better quality scan with some caveats.
So that was very informative. So please remember, you get what you pay for. Next very important question which most of my patients ask, and it's a question for general public. It's a question which is there in general public's mind, is why somebody asks for a CT scan, why somebody asks for an MRI, why somebody asks for ultrasound, what's the difference? So how do we answer that?
So each of these modalities are good for certain pathologies. So an X-ray is very good for an initial trauma assessment. I mean, somebody has an injury, they want to know whether there's a fracture or if there's no fracture, it's a soft tissue injury. If there's a fracture, they would typically put the joint in a cast. Sometimes patients come in with an X-ray which is looking normal, but the patient has a lot of pain. In that case, a CT scan is very good to exclude a fracture. So for bony pathologies, CT is very good. Both X-rays and CTs are based on X-ray technology.
Okay.
So they would look at the bones very well, but the soft tissues are not very well seen on that. Whereas ultrasound and MRI both have to do with very good soft tissue assessment. So the ligaments, tendons, they'll be seen very well on ultrasound or MRI. In addition, MRI would also be able to see the joints, the bones, subtle fractures in which even if there is a bone bruise, it will be able to pick it up. and if there is a nerve problem, it will tend to pick it up. So deeper structures are seen very well on MRI. Superficial structures are seen very excellently on ultrasound. Looking at most of these, why would some doctor ask for a CT scan? The most common causes they would say is for looking at fractures or to look for bony pathologies or calcifications. So calcium is not just the medicine that you eat, it's also there inside your body, and sometimes you can have an abnormal calcification which can lead to severe pain. So for that, the CT scan is quite good. Ultrasound is very good for superficial structures. So if you want to look for, say, superficial tendons or ligaments, like tendoachilles, which is the tendon at the back of the ankle, if you want to see that, it's very well seen on an ultrasound. And you can repeat it. There's no magnetism involved in it. There's no X-rays involved in it. Ultrasound is based only on sound waves. It's safe to be used in small kids, in pregnant women, in anybody.
I believe it's safer among all the modalities.
Yes, yes. Okay. MRI is also a safe modality. However, like you mentioned, if the patient has a pacemaker or if this patient is claustrophobic. Claustrophobia means that they are scared of enclosed spaces. So one question which we ask every person is, can you go in a lift? Are you like comfortable going in a small lift? And if the patient says or the person says that I'm not comfortable even in a small lift, then that person is claustrophobic and probably would require either a sedation or an alternative technique of doing imaging.
Yes.
And there are some people who just out of anxiety they feel that that MRI is like a closed drum. It's not like a closed drum. On both sides it's open. Nowadays most MRIs have very wide bores, so you have a decent space around it. And for a foot and ankle study, your face will be out of the scanner, so it's not so much of a problem.
Yes. So you told about you told this that CT scan is primarily meant for bones. Okay. Then why do most of the gastroenterologists order for CT scan to look into the visceral organs?
So gastroenterologists look for they want to see the bowel, and when you want to see the bowel, if anybody has had a CT scan done, they are given a medicine to drink. That medicine opacifies, or basically it makes the entire bowel, the intestines, it appears white, and you can see the entire course of the medicine. So on CT scan, everything that you see is based on the shadows which are cast by whatever you have inside your body. So if you drink something which stops the X-rays, then that obviously is great. If you don't drink anything, for example, somebody says, I don't want to have the medicine. In that case, you will still get some sort of an assessment, but you will not be able to see the detail inside. And again, when you go for a heart study, so there is a CT angiogram in which they inject a dye into your veins, and that goes into your heart. Again, that dye is sensitive to X-rays and it leads to shadows, so you are able to see the entire structure. Yeah.
Okay. So one very interesting scenario that comes up in a clinic now and then is that patient has pain somewhere in his musculoskeletal system, say foot and ankle or knee. He has had all the investigations done, X-ray done, MRI done, ultrasound done, CT scan done, and everything is normal. Now what the patient should do? What is happening? Why the diagnosis is not being clinched? What do you think?
So there are a bunch of reasons for this. One of the most common causes of pain, which is, if all your scans are normal, is that there is either a cartilage problem in the joint. Scans, if they've been optimized.
Won't they be picked up?
So if the scan has been optimized for cartilage, then yes, you would pick them up. What does that mean? So if you go to a routine center and those scans are optimized for looking at big things, fractures or bone bruises or infections or tumors, but most of those scans are not optimized for looking at a very thin layer, which is hardly about some 2 millimeters or so, and sometimes even less than that, like in the ankle. And for that, what happens is that you need very high resolution scans, specialized imaging, and in that scenario, we will be able to say, like for example, I get almost every day 2 to 3 such patients whose scans are either interpreted as normal or as just having some small amount of joint fluid or something like that. And in most of those cases, we can pick up very subtle cartilage lesions, either on those scans themselves or on scans that we can thereafter take. So that's one of the reasons. The other causes of pain in the absence of anything else coming out on the scans is sometimes a metabolic problem. So if the person has vitamin D deficiency or a vitamin B12 deficiency, they can again have pain or numbness or something like that. Sometimes they can have neurological problems, so which means that there's a problem in the nerves. Some interesting cases we can get is the patient says that they have knee pain. We do the scan, everything looks fine, but the father or the relative says that look, there's definitely pain. So we extend this scan up, and then we find out that it's actually a referred pain coming from the hip.
Okay.
So it's very common that if you're looking only, like if we just say that the patient comes to us for knee pain, we do an MRI of the knee and leave it, that doesn't solve the problem. So we then try to say that what is the cause? Either it is there in the hip or it is there in the spine. So those things we need to do.
So the radiologist also have to make sure that his eyes and minds are open to the clinical diagnosis so that he can find the ways out to a good diagnosis, to a sure diagnosis.
Yeah. So oftentimes if there is a patient who has severe pain or who has some such symptom, we would call up the referring doctor and tell them that look, we're not finding anything in that particular area. Do you think that there's any other possible cause? So if you have this two-way interaction, or sometimes we talk to the patient and say that okay, आपके scan में कुछ नहीं, there's nothing there in the scan. What since when did this start off, or do you have any other problems? We have some very funny cases. Like sometimes one of my neighbors was mentioning that he has leg pain, and it started off from somewhere in the back of the leg and went all the way down. So they did an MRI of the knee, everything was normal. He doesn't have any back pain, but his history was that he had started off doing a lot of running and cycling after the COVID lockdown. So I've seen such cases. So we went ahead and did an MRI of the lumbar spine, and he had a disc herniation which was pressing upon a nerve. Now in that case what was happening was there was no back pain, there was no typical sciatica symptoms, nothing going down from the back, but it was isolated pain coming in the leg.
Oh, wow, that's interesting.
Yeah, so that's a subset of patients. You have to think out of the box, try to figure out why does the person have the symptom.
That's great. So for our audience, it's very important that you select your radiology center very wisely, and you should be very cautious about choosing which specialty you should go to. Even for the radio diagnosis, you've already chosen a subspecialist for your treatment, but now it's the time to choose a subspecialist in radiology so that you get the correct diagnosis and worth for your money. So this was all for today. Hope all of you must have benefited with the answers given by Dr. Sriram Rajan, and we will continue to educate you about the medical tips and medical knowledge every week with some of the most eminent faculty in healthcare from New Delhi. We will leave no stone unturned in putting your best foot forward. So allow your own foot and ankle surgeon Dr. Abhishek Jain from Delhi Foot to sign off today. So for next week, we will have one of a very senior orthopedic colleague with us to share his invaluable knowledge with all of you and answer your queries. So please like, share and subscribe our Delhi Foot channel. See you next week. Thank you.